Now, the anatomy of the nasal cavity. The airway begins functionally from the nares, that is the external opening of the nasal cavity. The nasal cavity is divided into the right and the left side by the formation of a nasal septum. Nasal septum is formed of septal cartilage anteriorly, and posteriorly it is made up of two bone, ethmoid bone superiorly and the vomer bone inferiorly. Now, the lateral wall of the nasal passages is made up of uh, three specialized bone, three turbinates or choanae that divide the nasal passages into three scroll-shaped passages, that is the meatus. The inferior meatus, that is formed between the inferior turbinate and the floor of the nasal cavity, is the preferred pathway for passage of any nasal device. So during insertion of such devices, there can be avulsion of a turbinate. The roof of the nasal cavity is formed by the uh, cribriform plate, part of the ethmoid bone. This fragile structure, if fractured, can lead to communication between the nasal cavity and the intracranial cavities, which leads to the drainage of the CSF. Because the mucosal lining of the nasal cavity is very vascular, any instrumentation can lead to epistaxis. So, vasoconstrictor must be applied before doing any instrumentation in the nasal cavity. Now, the posterior opening of the nasal cavity is called the choanae, that opens into the nasopharynx.